listen up. This is Dr. Sam McGinnis, and we're going to talk about otitis media, which is basically middle ear infections. Now, I want to clear something up right away. Chiropractors do not treat ear infections. We treat cervical subluxations or joint dysfunctions in the cervical, thoracic, and lumbar region, as well as in the extremities. But what we found is, as a chiropractic profession, that when we adjust these cervical misalignments, a lot of ear infections, especially in younger children, will resolve. Behind this is that when the eustachian tube, which is basically a tube that's inside the ear that allows the ear to drain, gets plugged up, the middle ear fills up with fluid and can get infected, and that's what causes that pressure. That's the pain behind that middle ear infection. So when there's a subluxation or a joint dysfunction in the cervical region that hasn't been corrected, when we correct that, a lot of time that relieves pressure on that eustachian tube, which is deep inside the skull area, and allows that inner ear to drain. Now, the beautiful thing is with kids, what we find is that they respond very, very fast, and it would only take a few visits in order to see if that would actually help them or not. The medical model for treating ear infections, the gold standard, is antibiotic therapy. Matter of fact, out of all the antibiotic therapies given over to children, 40% out of all of them are given strictly for otitis media. So that's majority of the antibiotics given out to children for a condition are given out to otitis media, which is the middle ear infection. Now, 1/3 of those cases are going to be chronic ear infections where the child gets more than 3 ear infections. And though that antibiotics does clear up a lot of, well, about 70% of ear infections, because 30% are viral, which antibiotics doesn't really do anything to viral ear infections. But even though it does clear up the ear infections quite well, we expose the gut flora to the antibiotics. And so gut health is extremely important when we look, especially recently with the research that's come out. It's tied to your immune system, to inflammation levels within the body, to obesity, to autism, to ADD, to all kinds of different things. And when we look at the gut flora, which is basically this colony, hundreds and thousands of colonies inside your body that live and interact synergistically with you, we find that when we damage them, we are setting ourselves up for less productivity and less of a favorable outcome later in life. So, obviously there's a balance between the severity of the infection, which would require antibiotics to care. If it's a bacterial infection, would require antibiotics to help get through that, and the cost of damaging your gut flora, especially at such a young age, because most ear infections are before the age of 6. So with those that are on chronic treatments for ear infections, that have 3 or more ear infections are chronically being treated with antibiotic therapy, this risk becomes much higher. And so what we do is we like to encourage our patients to consider chiropractic care. Chiropractic care has been shown as a side effect of correcting the cervical subluxations to relieve otitis media, relieve the symptoms of ear infections. And there's a couple different studies. The research is still coming out on this, but there's a couple different studies that are, there was one study that was a retrograde study. It was on a clinic that was in Minnesota that looked back at all the different ear infections they had treated, and they looked at their notes and their records, and they realized that 93% of the people they treated showed improvement, and that 75% improved in 10 days or less. And this is very important because when we look through our history and our records, we realize that we have a very similar type rate of recovery. Most people that come in with, most children that come in with an inner ear infection or middle ear infection, sorry, not inner, middle ear infection, see resolved in symptoms after a few treatments. And then they avoid the antibiotic therapy, which is damaging on their gut flora. So what I would encourage you is to consider chiropractic care for treating your child's middle ear infections as a first step protocol. And of course, if we find that within 3 to 6 visits the child is not resolving from their ear infection, we automatically recommend that you go and get that antibiotic therapy because the conservative care isn't working. But if we can avoid, and most of them we can, if we can avoid the antibiotics altogether, then the child's going to be much healthier in the long run. So I would encourage you guys to think about that. When a child comes into our office, we use very, very low force techniques. We have an instrument, an activator instrument. I have one actually right here with me. I used a very low force. It makes a little clicking noise. It's very, very low force, and we're very, very careful with adjusting the children. We understand that a child's spine is mostly cartilage, and so it needs just the tiniest amount. It's actually quite shocking how little force they really need in order to get those misalignments and those joints to move correctly. So that's what I have for you guys for today. You guys enjoy the rest of your day. Enjoy that snow. I know in Wisconsin here we are experiencing quite a bit of snow showers in April. So I guess instead of May flowers, we're getting April snow showers. So you guys have a wonderful rest of the day, and remember to live as if you're going to live to be 100 years old, because the largest growing demographic in the United States are centenarians, people that are living to be 100 years old. So we have to plan that way. We plan with our finances, we plan with our families, with our legacy, and we should be planning with our health too as well. So you guys need any help with that, you can give our clinic a call, look at our website. We have some articles. We'd love to help you with your lifestyle and with your journey, your health journey. So without further ado, you guys have a fantastic day, and I'll see you next time.